pause too. Your name is Mrs. Tucker. Good afternoon, Mrs. Tucker. My name is Morgan. I am your student RN, and I'm going to give you a head-to-toe assessment. I'm going to wash my hands, and while I'm washing my hands, I'm looking for my 60-second safety check. No cords are on the ground, no trays, no kinked IV cords, no precautions on the door. My patient is not in distress, and there's no tripping hazards on the ground for either my patient or me. The bed is locked and lowered and in a safe position. She has her call light, and I'm gonna ask my patient, can you tell me your name and date of birth?
My date of birth is November 6th, 1990. My name is Heather Jackson.
Okay, I'm gonna check that on your ID band. Good. And you don't have any limb alert bands, so I know that if I need to get a set of vitals, my blood pressure cuff can go on which arm. Do you have any allergies? I'm looking for a band. You don't have any?
No allergies.
Okay, great. I'm gonna provide privacy. Do you have any pain that you need me to know about today?
Not today.
Okay. So you know what I'm gonna do today. I'm just gonna be checking your body out, make sure that everything looks good. And if at any time I press on something and you have pain, let me know, okay? And I can see that my patient is not in distress, so I know that my A&O is ×1 at least, because she knows her name. Do you know what brought you into the hospital today?
No. Yes, I do.
Just a checkup, right?
Just a checkup.
Yep,
yeah.
Okay.
No pain.
Right, okay. So there's person, place, and you know what time it is?
Yep.
Okay, and you can tell me the year.
Mm-hmm.
Okay.
2020.
Good. Okay, great. And let's see, we're going to start off by getting a set of vitals. I'm gonna have my CNA grab a set of vitals. So that'll be good. So while my CNA is grabbing a set of vitals, we're gonna start with the head, and I'm gonna start pressing on your body. Let me know if there's pain. Do you wear any contacts or
No.
Hearing aids? Good, because you need to have those in so that you can understand me. So I'm going to check for cleanliness and lice and lumps and bumps on her scalp and the back of her neck, and her face is pink, warm, and dry from what I can see. And I'm looking for any wounds. If I find any wounds throughout any point in time during this assessment, I would assess for the appearance, the size, the drainage, the drain tubes, and assess whether the dressings need to be changed and take care of that immediately. Her face doesn't have any wounds, it's symmetrical. I'm going to look at the mucous membranes. It looks like she has good white conjunctiva, no pink eye yellowing of the eyes. Okay, so I'm going to do an eye assessment. This is my pen light. I'm going to shine it in your eye, and you're just gonna follow it with your eyes, okay? So I shine it the first time. I'm looking at that eye to see if it constricts. They're equal, round, and reactive to light. The second one, I'm looking at this eye. Good. And we're going back again. Looking at this eye. Great. So they're equal, round, and reactive to light. And they are consensual in constriction. There's no blown pupils. So I'm checking her cardinal field of gazes. So you're just gonna watch the end of my pen light. Just move your eyes, not your head, okay? So we're gonna go down. Good. I'm checking for nystagmus and eye crossing. Okay, looks great. I'm also going to use my pen light to look for any runny nose, swelling up her nose. And I'm going to ask if you could open your mouth. Do you wear dentures?
No.
Okay, good. All right, and we're looking, everything looks pink and moist, no dehydration problems, no teeth that are loose, no swelling. I'm going to take a look at her ear. I'm looking for swelling, redness, any CFS or CSF. I'm looking to make sure that there's no mucus coming out or earwax. I'm looking at the other one. Everything looks symmetrical. I'm going to ask if you could move your head up and down and back and forth. No pain?
No.
Great. I'm going to move on to the neck. So I'm looking at her neck. Everything looks pink, warm, and dry. I'm going to check her pulse on this side. Good. Good. Okay. Oh. All right. We've got your service dog here. Okay. So I checked your pulse and I'm checking for any swelling, lymph nodes. Good. Everything feels good. Do you have any problems swallowing? No.
No.
Good. We don't have any dehydration issues. Okay, so I'm going to move on to your chest and I'm going to expose it, but I'm not really. Okay, so I've exposed her chest. I don't see any, I'm looking for symmetrical, no paradoxical movement. There's no wounds. Everything looks pink, warm, and dry. I'm going to do a trigger test. And there's no tenting. Let's see. I'm looking. Everything looks normal. So I'm going to listen to your lung sounds and your heart. Do you have any lung or heart issues that you know of? Okay.
No.
Great. So every time I move my stethoscope, I'm going to ask that you take a deep breath. Okay. I'm going to go fast though. So I'm listening for a full breath on each of these. Okay. Okay, we're going to start here. 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Okay, for the sake of time, we're going fast in this video, but I'm listening for a full breath And my upper airways, I'm going to hear my bronchial lung sounds. My middle airways, I'm going to hear my bronchiovesicular lung sounds, and my lower airways are going to be my vesicular lung sounds. Each time I move my stethoscope, I'm moving it in between the interstitial spaces and not over bone, because you can't hear lung sounds over the bone. Next, I'm going to ask that if you can sit up and lean forward for me. Great. I'm checking the back now. I'm exposing the back. I'm looking to make sure that her neck, all the way down to her butt and her coccyx area, there's no wounds. It looks pink, warm, and dry. I'm especially looking for any imblanchable areas, because that would notify me that we have a pressure injury starting to form. I don't see anything. We're pink, warm, and dry, and I'm looking for any pain or broken bones, nothing. But I'm gonna listen to your chest here again. Same thing, when I move my stethoscope, take a deep breath in and out, okay? So I'm going behind the scapula, not over it. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9. Okay. I heard normal lung sounds. Everything was no paradoxical movement, symmetrical. I'm going to move on to the heart. So I'm starting with my aortic at the top right, next to the right sternal border. It's in the second intercostal space. This is where you're going to hear your S2 sounds are going to be more prominent. And the same thing with pulmonic, second intercostal space on the left sternal border. S1 sounds. I'm listening for I'm looking for any murmurs, bruits, or pericardial friction. I'm going down to my herbs point, and S1 and S2 are equal in the herbs point, and we are in the third intercostal space on the left sternal border. Okay, and then we are going to the tricuspid valve. S1 sounds are the loudest in tricuspid and mitral. We are in the fourth intercostal space on the left side of the sternal border. And then I'm going to my mitral valve, where in the fifth intercostal space in the mid-clavicular line, so it'll be about here. Okay, so I'm going to listen to this for a full minute. This is my PMI, or point of maximum something. I gotta look that up. And then I'm also going to get a respiration if I need to, but I've got my CNA working on my vitals. Okay, so this is where I'm looking. I'm moving on to her abdominal area. I am going to look, listen, feel first. So I expose her abdomen. I'm going to be pressing on your belly. So do you have to go to the bathroom?
No.
Okay. So I'm going to start in the right lower quadrant. I'm looking and listening and feeling. I'm looking for any tenderness, swelling, masses, guardedness, rebound guarding. I'm listening for peristalsis, and I'm also looking for any bruises, bleeding. Skin looks pink, warm, and dry. So I'm going to go ahead and get started. I'm going to listen first before I palpate. Look, I'm listening for, again, bruits and peristalsis. So I'm starting in the right lower quadrant. I'll go up to the left upper or right upper quadrant, left upper quadrant, right, left lower quadrant. I'm listening for 15 seconds. If I don't hear anything, I want to listen for a full minute in each quadrant. I don't hear any abnormalities, so I'm going to start palpating. Let me know if you feel any pain, okay? So I'm looking for grimacing and facial expressions and any rebound tenderness, okay? Right lower, right upper, left upper, left lower. Great. And I am looking for just symmetricalness, any distension. That's about it for that. So I'm gonna look at your bladder in that area. Do you have any pain?
No.
No? Okay. And when was your last menstrual period? 3 weeks ago? Great, thank you. And do you have any, are you going to the bathroom normally?
Mm-hmm.
Good. And you have a regular poop schedule?
Yep.
Okay. So if she has a catheter, I'm going to make sure that it's patent, no kinks. I'm going to measure I's and O's, and I'm looking for color, odor, clarity, and amount. I will measure that, and I'll note that. And I'm going to do a press on her bladder. There's no distension that I can feel. And then I'm going to ask her to roll over to her side. And I'm checking her back. And we're going all the way down to her heel. I'm looking for pressure injuries, any implantable areas to alert me for that, especially the coccyx area. I'm looking under the folds, and everything looks pink, warm, and dry. Good, thank you. You can roll back over. All right, so I'm going to start with the arms now. So I'm gonna palpate I'm gonna feel each arm and each leg. I'm looking for swelling, tenderness, edema in all of the body systems. I'm looking for edema. I thought I would mention that really quickly. Great. Everything looks pink, warm, and dry, no wounds. I'm looking for her brachial pulses to be equal, and rate, rhythm, and regularity, +2, strong, equal. Okay. I'll feel radial pulses. Strong, regular, rate, and good. So each finger I'm going to do a recap on. 3 seconds. Great. I'm looking at her nails. There's no fungus issues. Everything's clean. Okay, I'm gonna move down. Oh, first we're going to do a strength assessment. So I'm gonna press on your arms and you're gonna push back up on me. Good. And I'm gonna hold your arms down and you're gonna pull on me. Pull down. There you go. Good. Can you lift your arms up all the way above your head? Great. And sideways. Great. Forward. All right, and put them down. Great. I'm going to check out her legs now. Palpate from all the way down. Any pain, let me know. I'm looking for DVTs. If there is pain, I'm going to stop right there. Okay. I'm looking for edema, swelling, skin looks pink, warm, and dry. I'm going to feel these inguinal pulses. Rate, rhythm, and the quality is normal, +2. Popliteal pulses. Okay, I'm going down to the posterior tib pulses and dorsalis pedis. Okay, all present. All right, so we'll do a cap refill on each toe, 3 seconds. Good. All right, everything checks out to be normal. Yep. I think I grabbed everything. I would do another 60-second check. My bed is locked and lowered. She's got her call light, and I'm going to wash my hands, note anything on my documentation. Mrs. Jackson, can I get you anything else?
Oh, great, thank you.
All right, so I don't have any cords. I've left her IV intact. No cords are kinked. No trash. Okay, and we're done.
We're good?